UK Prime Minister Boris Johnson plans to end all remaining COVID-19 measures in England in less than 2 weeks. That is 1 month earlier than planned. Johnson spoke about this earlier today when he addressed Parliament.
Provided the current encouraging trends in the data continue, it is my expectation that we will be able to end the last domestic restrictions, including the legal requirement to self-isolate if you test positive, a full month early.
Reporter Abby Kugadassin is standing by live in our London bureau. Let's talk timing, Abby. Why is Boris Johnson making this decision now?
So, Hannah, he says they've made this call now because the numbers are encouraging, that the trends are looking pretty good. And so the move to drop all restrictions is warranted, and even to drop them an entire month earlier than originally planned. So in less than 2 weeks' time, if someone tests positive in England, they will no longer need to self-isolate. Some measures may remain in place, like online passenger locator forms for travelers and quarantine for unvaccinated visitors. Now, Johnson, again, looking to finalize these changes in about 2 weeks' time. Now, England has already lifted some pandemic protocols at the end of January. There is no mask mandate on public transport or in indoor spaces like shops right now, but there are concerns that though some 84% of people in England are double vaxxed, that number falls to 65% when we're talking about those who have their boosters. And experts have said that this is the shot that's vital in warding off the Omicron variant. And this announcement now comes on a day when another photograph has emerged showing the Prime Minister with colleagues near an open bottle of alcohol. This will only add to the Partygate scandal and questions about whether he's rushing these pandemic moves to take the heat off. But we do know, and we have to remember, that some European countries have also taken similar steps in reopening. Denmark led the way here in Europe. Sweden has started reopening today, and the World Health Organization has said Europe is heading towards, quote, a possible end game. But this good news, Hannah, is for those living in this region, in wealthy nations with access to vaccines, with good vaccination rates, and this is not indicative of the global picture in this global pandemic.
And let's look at that global picture. I mean, you mentioned the UK, Scandinavian countries, they're going to have fewer and fewer rules. And then you talk about the, parts of the world that don't even have access yet to COVID-19 vaccines. So where do things stand globally?
Well, it's absolutely different depending on where you call home. The World Health Organization has cautioned countries, particularly in Europe, from claiming victory over this virus. One advisor this morning said it has repeatedly surprised us and we should remain vigilant. And the vaccine inequity remains a problem, as you mentioned. The Brookings Institution says some 1/5 of Europeans have received a booster, but that number is well below 1% in the whole of the African continent. And this, again, has very much to do with the access to the vaccines. And aside from the worry that low-income countries aren't getting the medicine they need for their populations, we know that this virus does not see borders. The WHO has repeatedly said that without ensuring vaccine access in all nations, there is a higher likelihood that COVID spreads. And if it spreads, there's a higher chance it will mutate. And we'll all remember when Omicron first emerged, the fear was it had mutated to a point that would evade the vaccines we do have to protect us. So while some wealthier nations are looking to return to some semblance of a normal life, the health experts have repeatedly said this pandemic only ends for us, Hannah, if it ends for all of us.
We will talk again, Abby. That's reporter Abby Kugadassin in London.